Disabilities Issues and Updates on BCTV is supported by the Berks County Center for Independent Living, Abilities in Motion.
And welcome to Disability Issues and Updates, brought to you by Abilities in Motion, the Center for Independent Living for Berks County. I'm your host, Ed Granger, and I'm the Independent Living Services Program Director at Abilities in Motion. And I'm very excited to hear from our guests today, who are representing the City of Reading Advancing Health Literacy Initiative, which is a bit of a mouthful, but they're going to unpack that for us today. Dr. Paige Brookins and her colleagues Enid Narvaez and Caitlin Kammerer are here to talk about the work of the City of Reading Advancing Health Literacy Grant and their roles as part of the grant. Dr. Brookins, Enid, and Caitlin, welcome to the program.
Thank you.
Thank you.
So I guess let's start off with kind of the obvious question. Can you just kind of summarize for our viewers kind of what the Advancing Health Literacy Grant is and kind of how it came about?
So in 2001, the City of Reading was awarded a grant through the Office of Minority Health to address challenges of health disparities magnified by the COVID-19 pandemic. This is a 2-year grant from 2001 to 2023. We are now extended in a no-cost extension year, and we will complete it as of June 2024.
Okay, so can each of you maybe describe a little bit about what your specific role is in the context of that grant that you're working on?
Yes, so as you said, I'm Dr. Paige Brookins. I'm the Director of Health Equity here in the City of Reading with the Advancing Health Literacy Grant. I work with these young ladies, this is my team, as we create a partnership. My main responsibility is creating partnerships with organizations within the City of Reading that are aligned with our grant deliverables and to facilitate the internal operations of this particular grant, specifically like budget, personnel, and things of that nature.
Hi, my name is Enid. My primary role for the grant is community engagement and social media. So a lot of the work that I do is centered around getting community-based organizations to participate in a lot of the initiatives of our grant, and also surveying our community to understand their needs, and then creating educational materials to give out to the public, and also updating social media so that our public stays engaged.
And I'm Caitlin Kammerer, and I'm the project director. And my main focus is to support these two ladies and the efforts that they're doing in our community. I also work with our other teammates over at Reading Area Community College, Penn State College of Medicine, and Latino Connection. And I work to make sure that we are making measurable changes on our deliverables and making sure that we are in communications with our funder, the Office of Minority Health.
Okay, so we're kind of talking here, and this is not sort of at the outset, so we're about to launch, we're sort of in midstream a little bit. So talk a little bit about what stage the work is in currently, kind of what you've done so far, what the next steps are. Kind of what we can expect.
Absolutely. So over the last year, we had made huge strides in our community by going out and surveying our community based on their levels of health literacy, their understanding of common medical terminology. And through that baseline survey, we were able to collect data that helps navigate our system. So what we've learned from those surveys is a big percentage of our community is already vaccinated and up to date on all of their COVID-19 vaccinations. We also learned that we do have a limited health literacy level amongst our community. So when a resident goes into any medical provider, they may not have a clear understanding of what the medical provider is saying or wants them to do. So with our efforts, we also partnered with organizations, health serving organizations in the community, and gave them a health literacy assessment to identify maybe areas where they could strengthen their health literacy to support the community that they're already doing great work in. So it could be signage, navigation, and the ability to have cohesive language that is culturally and linguistically appropriate for those in the community. And where we are right now is utilizing all that data that we've collected to produce health materials that are at a health literacy level that allows our community to understand the medical terminology and what follow through they should be providing for themselves. In the upcoming months, you'll see us at a bunch of our community events throughout the city of Reading, offering information on the misinformation toolkit that Enid has beautifully put together with her team, about understanding what are trusted sources of information. Are we just getting information from Sally Sue's blog and saying it's appropriate? Or are we looking at CDC information? And then after that, we'll be working on creating health materials, again, that are appropriate for our community's needs, and we'll be resurveying our community. And within those surveys, we'll be reassessing where our community is in their health literacy.
And obviously, earlier in the pandemic, we saw a lot of misinformation. A lot of people were checking out Sally's blog, and then they were posting Sally's blog on their Facebook pages, and it was, then next thing you know, Sally's blog was viral, and Sally may not have had a PhD
Right.
in virology
Correct.
or vaccines and those kind of things. And it's interesting that you mentioned what you saw in terms of the vaccination rates, because we were part of a CDC grant to reach people living with disabilities about their vaccination status and again, address some of those myths. And we found pretty much the same thing you did in terms of a lot of the people we reached were already vaccinated in many cases, which that was the good news.
Yes.
Then we had to correct some of the misinformation. That took a little extra work, but so there's an interesting overlap between your effort and what we were doing with that grant, which was a couple of years ago now. But it's it's interesting that we kind of learned some of the same things, I think. So what are some of the major challenges that you find to improving health literacy in Reading?
So a lot of the struggles we have as a whole is knowing and understanding the various social determinants to health and how they all kind of affect a patient in very many different ways, and using that understanding and working with the community so that we understand their culture, so that their education can be appropriate for them, and so that we can support them not only from the basis of where we come from as representatives of our local government, but also to provide a network of tools that are culturally and linguistically appropriate for them, and provide these tools, these other organizations that are also doing the work that might not necessarily be centered around going to your clinic, but maybe going to your community pharmacy, right? Or knowing where to go and get housing assistance, or knowing where to go and get good healthy food if you need it, various other things. But that's one of the biggest challenges I feel for the community. If anyone here wants to speak on the organizational side, struggles,
One of the things that I've seen working with organizations is just the lack of resources. They want to do better. They see that the needs are greater and they want to be able to provide those needs, but the resources are limited. So, as we're working with these organizations, we're helping them to see and to assess what they're currently doing to be able to make changes that are impactful. And with those changes of impact, we want to create sustainable change. From this point on, it's like when you don't know how to do something and you figure it out, then you continue to do it and the change becomes even more impactful. And hopefully that domino effect will then be created within our patients, understanding from a personal standpoint how to properly navigate the healthcare system, but then ultimately then the system has changes that are made that they just meet each other right there and be able to do better, do more, and be more literate in healthcare.
And Enid, I think you also mentioned social determinants of health, and that's something that if you're paying attention at all to what's going on in advancing healthcare, making it more accessible these days, that's a term that people are going to be hearing a lot, the social determinants of health. And we had Juliet Simplicio from Reading Hospital Tower Health on to talk about that, because that's sort of her role, and she shared a lot of great information about her role and the importance of how so many other factors in people's lives impact their health outcomes, and that was really eye-opening information. So it sounds like you're really sort of tied into that idea as well. So let's talk about, how does health literacy impact health outcomes?
You want to go first?
I'll go first. So from an organizational standpoint, our goal is for organizations to create materials and address the public using the national class standards. We talked about that, Enid and both Caitlin, in regards to materials being culturally and linguistically appropriate. When we, as individuals, are given information, if it does not apply to us or we do not understand it, then how can we utilize it? How can we make changes? Or they prescribe something to us and we just don't know. But if it's something that we do on a day-to-day, it's in our culture, it's in our language, and we understand, then we're more in tune to apply it. So we're working with organizations to be able to do that. Patients then are able to better understand, feel comfortable, they're able to advocate for themselves and for each other as they are navigating the healthcare system. In return, the goal is, to lessen the use of emergency departments and to encourage more consistent physician care, to be more proactive rather than reactive.
And from the guise of the community and the patient themselves, it's super important to empower people. Once you empower people, there's so much more they can do for themselves. And once you meet someone where they're at, whether it's, you work for Abilities in Motions, oftentimes the disabled community is one that is not thought about at the forefront when it comes to things like navigating or accessing even physical barriers. Oftentimes I think the data shows that a lot of the physical barriers that our constituents are dealing with when it comes to their health are language barriers, and they're also navigation barriers. A lot of them are also social determinant barriers, working, not having the time to go and get care, or not having the transportation to go where they need to go to, or even if all of those things are taken care of, perhaps they don't have the socioeconomic supports to be able to address those things.
And we find so many people are caregivers that they don't have time to care for themselves.
Absolutely.
And that's something within the disability community that we see a lot.
Yes.
And I think it's great that you mentioned that the importance of the accessibility of the information, because that's something we're always striving to put forward for people who are living with disabilities. So it's not just the physical barriers potentially, but also how the information is presented. Are we using plain language? Are the fonts easy to read? All those kinds of things factor into the accessibility of how that information is provided. And I think we could all do better, and we're always trying to do better and also educate others along those lines. So I think that's another nice sort of way our work sort of overlaps a little bit. So specifics, let's go to some specifics in terms of some of the initiatives, activities, of the health literacy grant. I know it's kind of been broken down into some categories in the way it's been presented that I've read in terms of communicate, advocate, educate, reduce. And you can talk more about what we're trying to reduce, as we sort of the specifics of the work.
Absolutely. So some of our initiatives were right here on Penn Street, where we had a COVID-19 vaccination Kate clinic with our partner Latino Connection. So one of our big thing was that gave our community access to a vaccine provider to talk to community health workers that spoke the same language and was able to give an explanation more in layman's terms that we're able to understand it. And through that Kate Clinic COVID mobile vaccination clinic, we were able to vaccinate just about over 300 community members.
Wow.
Just in about 22 mobile units that we had. And we were out here every Wednesday in the summer of last year. Another one was, especially for Educate, is our partners over at Penn State College of Medicine had an educational series for certified community health workers about advancing health literacy and how to support the people and communities that they work to on health literacy. Not only that they could bring it and spread it to the patients or people that they work at, but also that they could bring it back to their organizations and support making changes to that as well.
Did you find that was well received? Were people receptive to?
Very receptive to that, and it seemed to be through conversations within the groups taking the trainings is how helpful this was and how real world it was, because they would work with a patient coming from a primary care provider, and the primary care provider said, oh, hi, you have high blood pressure, and the patient walks out going, like, oh, I can't eat red meat, when there's so much more to that. And that community health worker was able to gain the knowledge to support that client in making certain changes that they would have to with their
And I
health.
guess when it comes to reduce, we kind of already had a clue that we want to reduce things like emergency room visits, right?
Emergency
So
room visits,
negative outcomes
absolutely.
that we want to reduce. So positives that you've seen, what are some of the positive impacts? I mean, you shared a little bit about that, but are there some other things that you'd like to share in terms of, what you've seen that lets you know, hey, we're on the right track here?
I would say one of the many positives of the work that we've done is to be able to get a baseline data representation of the specific needs within inner city limits of the county. The data shows that we have a high need of accessibility within our senior population, but also surprisingly, quantitatively speaking, the age group of 30 to 39, which says a lot about the cultural makeup of the city. And that age group you talked earlier about caring for others before they care for themselves.
Right.
That age group, culturally speaking, are oftentimes helping support the older matriarch or patriarch in the family and supporting their younger siblings and working and forgetting about themselves. And I think that when you have something like qualitative information, you can take back to organizations, whether they're health serving or not, institutional, governmental, you can say, hey, these are the needs of your direct community. Here's what we can start doing now to help address it, to hopefully get that buy-in that a lot of people need so that we can do things to create actual, tangible, sustainable change over time to help address the issues and help create resources then for the greater Reading area and the county as well.
And I think one of the neat things is the data lives on, right?
Yes.
So once you have the data,
Yeah.
there's so much that you can do with that. So it
Absolutely.
gives you a lot of ideas once you sort of sit down and review that and and look at it. It gives you a lot of maybe some potential ideas for new grants, new initiatives. Because that data is, once it's there, it's yours, and there's so much that can be done with it.
Yeah.
Hopes for the future. Where do you want to see this go? Since we just talked about that, how it lives on, how it where maybe the work goes next, and maybe where it goes beyond just the end of the grant.
As you just said, Ed, when you have that data, you're able to paint that picture and to give the narrative of where we are in the city of Reading when it comes to our health literacy, when it comes to where the greatest needs lie. And one of our future endeavors is to show that we need a county health board. We need that resource here in this particular area. It will also help in creating that sustainable change that we're trying to create through this grant. As this came about because of COVID, we know that we have worked through COVID and, we're still dealing with it.
Right.
But just as COVID has come and it's still here, but potentially hopefully will be gone, we don't know what else is coming about. And as a result, we need to be prepared, properly prepared for what comes and lies ahead, as well as preparing our community members to be able to receive the proper services and resources, not in a reactionary type of stance, but more in a proactive stance. So that's, taking that data, creating that significant narrative that shows we need this health board
And
here.
once you have good processes in place, they're there, they're in place, you can revisit them, you can tweak them, you can move forward with them in new ways. So that's something,
Right.
I'm a program director, so that's near and dear to my heart and the work that I do.
Yes.
So if viewers are interested in this project, is there a way that they can sort of help you with the work that you're doing?
Absolutely. The best way right now is to go ahead and head over to our website. That is readingpa.gov/myhealth. And that's where you can learn about what's going on with our grant, but also just joining us and looking at our initiatives, seeing us. We'll be running surveys for the community, participating in those surveys, whether they're in person or online, and making sure that they learn, that our community learns how to advocate for themselves. We have multiple resources that are trusted resources on that website, and even interacting with us on our social media pages.
Yeah. I'm sorry. And to further that, the website accessibility is there, and you can translate our website to whatever language you're comfortable with. And there's also ways in which people who have auditory issues can also engage with the page with their limitations in mind. And speaking from what Caitlin was talking about, accessing a toolkit is available there to download on your own. It's in Spanish and it's in English. And there's also organizational tools and resources that you can utilize for your organization. So say maybe you missed the opportunity to go through one of our organizational assessments, but you think, okay, like what can I do to help better my organization? There's all that information listed on the website, a free resource to incorporate at your own will.
And I would wrap that up by saying to educate yourself and educate others. So as Enid and Caitlin mentioned, we have multiple and many resources, links on our webpage. We are also resources here in the community. We're local, we live here, we're a part of this community, we love this community, and that's the reason why we do this work. So reach out to us. Our contact information is on the website, but begin to educate yourself and to educate others on health literacy and how you can be better and do better.
So Dr. Brookins started the wrap up there. So before I do my wrap up of the show, is there anything anybody else would like to add, final thoughts that may have arisen? It's fine if nobody has any final thoughts, but I don't want to cut anybody short either.
Yeah, I just want to say thank you for this opportunity.
absolutely.
We're looking forward and doing great things, and it's a great opportunity for us to share with the Reading community at large and the Berks County community on what is happening here in the city of Reading. This is a great city, and we're doing great things. So thank you, Ed, for this opportunity.
Fantastic, and again, we're here to serve the disability community at Abilities in Motion, and we're doing similar kinds of things, and these kinds of partnerships are what's really exciting. Is there's strength in numbers, and the sum is greater than the parts. Whatever cliche you want to give it, but there's strength in collaboration.
Absolutely.
So appreciate you being on the show. And sharing your work, and it allows me to see how that connects with what we're doing at Abilities in Motion, also trying to do great things.
Absolutely.
But you certainly set a good standard for us to try to emulate. So thank you very much, Dr. Paige Brookins, Enid Narvaez, sorry. I knew I was going to get it wrong one of the times, probably got it wrong all three times. And Caitlin Kammerer from the City of Reading Advancing Health Literacy Grant. Thank you very much for being on the show. We look forward to seeing where the work goes, where you take it next.
Thank you again.
Thank you.
Disabilities Issues and Updates on BCTV is supported by the Berks County Center for Independent Living, Abilities in Motion.